Amen.
Thank you so much, President Lesego. That's our president and admin from South Africa. And we are grateful to have you here today and start us off with a word of prayer. So once again, before we get started, I'd like to invite our global president to welcome us to this session and to also tell us a bit about World Women Leading Change so that our director can understand who we are and what we are doing and where we are headed with our platform. Dr. Ayla?
Where is President? Where is Precious? Where is Director General? Waiting for Director General to come. Director General?
She's been disconnected.
Yes, no, she's here.
No,
okay. Okay. All right. So Dr. Ayla, kindly welcome on board and say hello to us.
Hi, everyone. My name is Ayla Al-Jufri, and I am the founder of a company called Ayla Associate, consultant, real estate consultant, global property bank technology center, and woman empowerment called World Women Leading Change. The purpose of doing woman empowerment is to empower women from all parts of the world to give, to inspire, and to lead and to change the industry, the circumstances or the situation. And today in pandemic time, we have managed to have 85 conferences, reaching out to 150,000 people. We have conference every day. Every Monday, we have creative arts, the president from Russia, President Ingrid. Tuesday, we have vocational, President Alice Kamunge, President WWLC Africa, and we have on Wednesday, we have real estate, President Debbie, and myself running the real estate. And we have Thursday beauty and also technology, President in Singapore, President Abby, Datin Sri Abby, with President Devi is running every Thursday. And Friday is a wellness day because after 1 week, we need injection of wellness. And Joy is President for Wellness. And Saturday, we have youth every Saturday, and also education run by President in India and in South Africa, President Lesotho. President in India is Dr. Rupa, and Sunday we have we have infrastructure run by President Rebecca, and also agriculture run by President Barnice, and also children run by President Joy. So enjoy the health, and I want to say thank you for the speaker, director of World Health Organization. Thank you for the time, and I will also acknowledge all president in here. Thank you so much for the time, and back to you, Joy. Love and light from Bogor, Indonesia.
Thank you so much. Thank you so much. That's our president and the vision bearer and the founder of World Women Leading Change platform. And we totally appreciate you, Dr. Ayla. So I'm also going to introduce our host today, who is also an amazing, amazing lady from South Africa. And she's also an amazing lady that has also been behind the growth of WWLC Africa. And we also love her so much. She's an amazing woman. She's a vice president for Africa, and that is Ambassador Debbie Dineo Raputi. Welcome, Ambassador Debbie.
Please, good afternoon, good morning, good evening to others. I'm so delighted that here in South Africa is a Women's Month. And today with us in the house, we've got our precious, I'm sorry. I'm sorry, there are people who have opened up their things.
Yes.
Yeah, I was just saying that today I've got a lady that I admire, the lady that I worked with the lady who is well vested about issues, not issues of health only, but issues in relation to women empowerment. And I really wanted to present to you the Precious, as the name says, is Precious Malebone Matsoso. She is a health expert. She is a health advocate. She is a powerful woman who understands issues of development holistically. Precious Matsoso, she was the Director General of Health in South Africa, Republic of South Africa, with 9 provinces. That is about 59 million people living here in South Africa. She was responsible for their health and development. Precious Matsoso also, she was the Director of Health in Geneva, in Switzerland. Precious Matsoso, really, I will go, lengthily about the capabilities that Precious Matsoso she's having. She have empowered a lot of women. And it is not only to be a medical doctor. The medical doctors reported to her, professors reported to her. She, I visited one country. I went to Denmark. When I was in Denmark, a Precious Matsoso, she was not there, Director General. But one lady said that, "Are you from South Africa?" I said, "Yes." And she said that, "Where is our Precious?" In Denmark. Then here I went, I was really in Brazil. When I was in Brazil, one other guy also came to me. "Hello, are you from South Africa?" I said, "Yes." And this guy said to me,
"Why wasn't that communicated?"
"President Mankole, I'm sorry, President Mankole, you're disturbing us."
Yes, our participants kindly request you to
Yes,
mute
please.
your mic.
And
Yes,
when I was in Brazil, this guy came to me. It's a male fellow. He said that, "Where is our Precious?" I said, "Who?" Yeah, this woman, she is really well known and she's been admired. Even myself, I admire her. And she doesn't want, we still call her Director General because we also go to her for counseling. We go to her and seek some advices. This is the woman who is also vested about health technology. If we want to understand the issues of health technology, and I'm of the view that a Director General must also talk to Dr. Rupa from India, who is also vested on the issues of technology. How can we fuse this knowledge together? A Precious Matsoso, Director General Jigelela, we just want to tell you that we admire you. Thank you that you went to school and you managed to acquire that knowledge that you can impart it with the world in general, the world Jigelele. We really admire you. And as we are celebrating the 1956 Women's March here in South Africa, you are also one of the remarkable women. Can you please receive Precious Matsoso Jigelela? I thank you. Over to you, Jolie Joy.
Thank you so much. Thank you so much, Ambassador Debbie, for introducing to us Mama Precious Malebona. Thank you so much. I think we already now have an...
You have muted.
And and we are very grateful to have you join us today. So for our guests today, just want to remind you that you are welcome to ask her questions, because we're going to have a Q&A question time. So if you have any question for her, feel free to ask. But we'll come to. But before then, let's first of all get to know her. So I want to go directly and invite her. Just Ambassador Debbie, kindly help me to welcome her.
Director General Jigelela, it is just like an ambassador. Your name will never fade here in South Africa. You have really served South Africa with distinction. And you have also served the World Health Organization with distinction. And I'm presenting our precious Malebona Matsoso, very analytical woman. She is very good with details. If ever some of you want to learn how you should be very analytical and very detailed, go to precious Malebona Matsoso. And on issues of systems, also go to Precious Matsoso. She will teach you how to be very systematical on doing things. I've learned so much. Women Mbogoto, Amandla, it's power to the woman. Can you talk to us? Tell us, Precious Matsoso, who you are, your journey until to Geneva. I thank you.
Well, good morning, everybody, and thank you for inviting me. It's a real honor. I would like to first say that it's very humbling to hear Ms. Debbie Raput say praise. She has another career of being a praise singer. That's singing praise. I have humbly served people of South Africa. I've humbly served the World Health Organization in its member states and being like previous.
I'm sorry.
So,
can you hear Gigi properly?
Sorry, we cannot hear clearly. We
cannot hear
from
properly.
a distance. Yes.
Can you hear me now?
Yes, we can.
Can you hear me? So I'll just put it close to my face. I was just saying that Miss Debbie Raputi is a praise singer. It's her other career.
Yes.
In that she does praise singing. And I'm humbled by her kind words. But I just wanted to say that I've actually been honored. I've been honored to serve South Africans, to serve the world, and to serve the African people. And it is indeed humbling to be asked to serve people in the manner in which I have, as a Director General, as a director, when I served my term in WHO as a Director of Public Health Innovation and Intellectual Property, as a Director of the Essential Medicines Program. So it's always important for us to remember that when we are in these positions, we're in these positions because we're asked to serve others. But I think increasingly what we see with leaders is that they see this as a way to be served. And I would appeal to this women leadership initiative that as you mentor, as you nurture, and as you bring up young women leaders, you should always put that as a reminder that you are put in these positions because we are put in these positions to serve. My first background is that I'm a child of God, and I'm happy that you started with prayer. I'm a pharmacist. That's my first degree, and I also did a postgraduate studies in health management, and I've got a master's in law, from Scotland. And I'm busy. I'm a PhD candidate. I have worked in both the public and private sector, and I've worked in international organizations, and I've chaired multiple meetings. I've been in the UN high-level panel appointed by the Secretary General, Ban Ki-moon. I've been the chair of the executive board of WHO, and I think the list goes on. And what I've learned in this journey is that we must use every opportunity to promote partnerships between the young and old. We must promote partnerships between public and private sector. We must promote partnerships between civil society and government, because increasingly what I've learned is that there's always a conflict because we don't engage in dialogue. And dialogue presents an opportunity to solve problems. Dialogue presents an opportunity to address these difficult issues that we have. Now, having served both locally and internationally, it's important to also know that health is a very important development indicator. A country who's young, a country whose women, a country who's elderly, a country whose people with disabilities, if those categories of people are not well looked after, it means we cannot talk development. So our principles of addressing development starts with us looking after vulnerable people. And as we do that, and I'm very pleased to hear that in all the categories that you've identified the young, and now you've identified women because you're dealing with women's health. And I'm happy that you have also addressed men's health, because what I've learned is that, and maybe it's a South African phenomenon, it doesn't happen in other countries, but in South Africa in particular, men don't come to our clinics. Men think that clinics are there for the elderly, for the babies and the mothers, so they don't come to clinics. So I'm pleased to hear that you've dealt with men's health. When we check our data on HIV/AIDS, how many people come for testing? In most instances, it's women who test. And what we've established is that men actually come and present in our facilities when they are already ill and when they are very ill. They come and present in our facilities due to trauma, due to violence. And I think the fact that you've addressed this particular issue for me is extremely important. And I'm very pleased that you have taken that as your agenda and not look at men's health as a men's issue only. That this movement will also take men along to make sure that they lead a healthy lives and that you have their well-beings at heart. I'm pleased that having looked historically in South Africa that you deal with women's issues. You know, to address health, you start with educating a woman. If you educate a woman, that woman will be able to look after her children. She will be able to address her children's health. In fact, if I were to look at COVID, if you just said to women, this is what needs to be done at home regarding COVID, this is what needs to be done in your country to address COVID, I can assure you the world would look different. I'm saying that because the recent reports actually show that where we have women prime ministers or presidents, they were able to act speedily and the infection rates are much lower in those countries. Germany was one country that was cited. Taiwan is another country that was cited, and as well as a few other countries, but I was citing these. Today, when you look at how many women presidents do we have, we've got 194 countries, and out of the 194, only 19 of them are led by women as presidents or as prime ministers. So the significance of that is that when we preach development, we need to understand that it starts with young women like you. It also starts with older women who hold you by hand. And I heard from your president from Indonesia, Ayla, from Ayla Technologies, I hope I'm right, that you have to nurture, you have to develop, you have to support young women, because supporting them will help them grow into leadership positions. Supporting them will help them to lead, but also to take along with them their male counterparts. Supporting them will help them deal with the vulnerable communities, deal with the disabled people, deal with the elderly, and also deal with those who need care most. They, in most instances, are likely to show compassion, care, but compassion and care without competence is inadequate. So we should look at the 3 C's together to say the journey that you've just started is an encouraging one, because you are saying to them, empower yourselves, build your competence in different fields, and based on that, also have care and compassion. And it is from that perspective that I would like to encourage you to do precisely that, to say, as you empower women, tell them to bring those aspects, those attributes of caring and attributes of compassion, especially in the health sector. When you are asked to serve in the health sector like I have been, I have understood that to serve in that way, you bring competence, you bring compassion, and you also bring a caring attitude. A caring attitude that put people first, that put patients first. Now, in this environment, a digital environment, I must disclose that I'm currently the co-chair of the WHO Digital Health Advisory Group. And I've been thinking that this exponential growth, that means that there's doubling, there's a lot of movement in the digital environment. I've been wondering as to what is it that we need to do that can help us move the health agenda forward. Now, because we are talking about wellness, there are quite a number of digital tools that are used in the wellness environment. We have what I describe as wearable technologies. Wearable technologies start with those that you wear, when you exercise, wearable technologies that are useful for reminding you about taking your medication. But I think we've also seen other digital health tools in a form of applications that are used to educate the public, especially during COVID and even not during COVID. And these apps are important. For instance, the experience we've had in South Africa has been to develop Mom Connect that helps pregnant women when they go through their antenatal visits. One, to have reminders. Two, to at least know what is it that the health workers are saying, but to also give us feedback about whether they're happy with the services that they've been exposed to, the services that have been rendered for them, and services that they would like to have, but also feedback about the conduct of the healthcare workers as to whether did they treat them with care, did they treat them with compassion. So we must see these tools as an opportunity not only to impart information one way only, but as a feedback mechanism about the services that we render. It may not just be in the health sector only. It can also be in the education sector, where the tools are used as feedback about the performance of the children, of the learners, and feedback also from teachers to parents, feedback from children to their teachers, and the learners from their teachers to the, it can be a feedback loop. So these tools, if we want to be productive, if we want to engage, we must, in their designs, in their usage, we must build in those feedback loops and feedback mechanisms, whether in the health sector, in the education sector, in agriculture, for instance. We've seen in agriculture how Kenya used the digital tools for the farmers to get feedback and how they've used those. It would be good to learn from each other and use those as a mechanism by which you get feedback about the vegetables that you've bought, the fruit that you've bought, so that we use those as a way of not only supporting, but also of identifying shortcomings if there are any. I would like to also mention that for those of you who have visited the WHO Atlas, there is a WHO Digital Health Atlas. It's a very empowering tool because it tells you, even though it's not complete, but it's a good baseline for all of you because you are able to see what kind of tools are available in which countries and what kind of services are available and what those services can provide. So just from that perspective, I'm just being brief so that you can have a sense of in the digital environment what potential is there and how can it support your efforts as a women leading change and women wanting to make a difference in the lives of others. And in conclusion, I just want to mention that there's also an area of research and development that is my passion. And it would be good to invest in young people to conduct research so that they can have inquisitive minds. They can be able to answer very difficult questions, but also questions that can help us solve some of the difficulties that we are confronted with. So if we start instilling that inquiry, that sense of inquiry when they're young, and we start investing in making sure that there can be research and development in all fields, actually, this continent will succeed. The developing world will succeed, but it will also help us to reach greater heights. I would like to stop there. Thank you.
Wow, wow, amazing.
Thank you. Thank you.
Thank you so much. Thank you so much, Mama Precious. Actually, before I even started, I wanted to mention that you look really beautiful. I like your lipstick and your red scarf. You're looking very beautiful. I mean, this is just amazing, and it's a lesson for us that as we grow older and older, you know, we should not neglect ourselves. We should take care of our health. We should take care of ourselves and look beautiful always. So thank you for that, for sure. And you've shared amazing, amazing things with us. I like what you've told us about leadership positions and encouraging women. And you've given us 3 points. You know, we need to empower ourselves, we need to build our competence, and we need to have care and compassion, because that goes a long way. So that is really, really 3 amazing pointers that I have picked from you today. And I like what you're telling us about digital and health digital, because this means that, you know, everything to date it's going digital. And I also love the idea of investing in young people, you know, and helping them to be inquisitive. So that is really, really amazing, and I believe the leaders that we have here have picked those points and be able to do something about it. So I want to open this to our audience. So if you have any question for Mama Precious, this is your time. Please go ahead and ask her. But as we wait for others to ask, I have one question for you, because you've shared the amazing things you're doing. You've also, apart from medicine, you've also done a master's in law, and you have a PhD. You've worked in the private and public sector and all that, and I think that's amazing. And I just want you to share with the women we have here today, because one of the struggle that I see with women, especially with getting into leadership positions, is the issue of balance, finding a balance between our careers and our work, and even advancing in education. How have you found a balance? How have you been able to balance your career, your life responsibility, and also as a mother, and you know, as a family person? How what advice do you have for us women today?
Okay, maybe I'll take in response, I'll take a bit of steps, a few steps back. I grew up being an activist for change in my country. So from a very early stage, I mean, I must have been 16 years old when I was active, and it hasn't stopped. So activism comes with, you know, one's desire to have a better life for all, and to have this world as a better world where we can live in peace and harmony, and we can lead good lives, and there can be both life and livelihoods, and people can thrive. So with that background, from when I was young, I had to start learning how to balance activism and studying. And sometimes it's difficult because you have to go and organize students. You have to organize women. So when I was a student, I got involved in a number of community projects. We used to collect food because our university was in the north of the country, you know, where there was villages and a lot of poverty. So we used to collect bread because, you know, students are wasteful. They used to waste bread, waste food. So we would collect that and go to villages and serve people. And we would do the same for workers on campus. During lunch, when others were eating, would be in queues serving. So I learned balancing from that early age. But because the police were looking for me, I had to go on the run and so on. When I was a student, I was a mother and also a student, because I had to, you know, to disrupt my studies as police were looking for me, and I got married. But I was very clear that my desire of pharmacy, because I wanted understand how medicines were made. I wanted to have my own manufacturing plant. I always had these dreams. Hence, I'm talking about research and development, why you need to invest in that. So I used to be a mother and also a student. So I have learned the balancing act. Now, the balancing act is about not only work and motherhood, but it's also your spiritual life, your physical need in terms of making sure that you can exercise, being active, being able to serve communities, being in women's groups and so on, so that you are not only, a career focused at the expense of other needs, being able to be all rounded. And I think these are the things that we have to start instilling in young people, that we have to have a goal, yes, a career, achieve, but you can't neglect your family. That's why women become the most important leaders, because they can balance. Now, when you run government, you must have that balancing act. When you run a big organization, you must have a balancing act. So these are skills that you also teach others as you grow along. And others, of course, like they say, some people are born great, some achieve greatness, and some have greatness thrust upon them. But we have to build the leadership. We have to build their young and teach them that if you're in a boardroom, it doesn't mean you must stop being a mother. If you're in a boardroom, it doesn't mean you must stop being, serving your community. If you're in a boardroom, it doesn't mean you must stop looking after yourself. So that kind of balance is needed. I thank you.
Wow, wow, amazing. There you have it. I like this. Yes, if you're in the boardroom, don't stop being a mother. And if you're in the boardroom, and if you're a mother, you don't stop being a career person and pursuing your dreams. And also just finding your balance, being able to understand to balance all these things. And yes, as you say, those women who are actually presidents, they perform so well because they already learned to balance. And I like your story about about being an activist and running away to get married, as a break of taking a break from being an activist. But you really did an amazing job, and for sure, we can see the results, we can see the fruits of your labor. And that is why this Sunday we are celebrating women, women who have done great and amazing things in our continent and even in our globe. So thank you so much, Mama Precious, for that. So our audience, who wants to go next, for the question you have for our director? If you have, just switch on your mic and go ahead and ask.
President Joy, can I ask?
Yes, Dr. Ayla, you can go ahead.
I want to call Mama Precious because you're very precious for the world, and you're very precious to us. In fact, today, maybe I will, because we have 16 wheel in WWLC. WWLC is World with Love and Compassion. And today you put care and competence. What you're saying about volunteering, a lot of people don't understand what is volunteering. You have to volunteer in life. And today you have given an answer that maybe
President Ayla, we cannot hear.
President Ayla, yes, President Ayla, you got lost.
With or without compensation, because eventually there is a compensation, and the real compensation in life is happiness. It's when you see other people leading, And that is why, in fact, in WWLC, I call all the women that lead president, because that is, you know, the leadership that they have to take on the role. And I cannot say anymore. I'm very honored to have you talking in here today, and I am very pleased to listen to the story when you are activists, and it's just, I'm very proud, and you are definitely one of the women that have changed the world. Thank you.
Thank you for your kind words. I'm truly humbled. Thank you.
Well, yes, sure. I totally agree with Dr. Ayla that what you have actually, what you have done, and the journey that you have walked is a very inspirational journey. You remind me of one woman from Kenya called Wangare Maathai, you know, the lady who fought for our forest and our environment.
Yes,
Yes,
I
I
know her.
believe you know her. Thank you
Yes.
so much. So I'd like to ask another question before the audience, the questions come from the guest. So the situation that we are facing right now of the pandemic and the coronavirus, it has affected not just women, but everyone in this globe has been affected. So we'd like to hear your advice. We are yet to get a cure, and we are not sure what will happen, whether we'll get a vaccine or not. Would like to hear your advice. If we're not going to get a cure, or as we wait for things to get better, what is your advice from where you sit, and especially being from having a background of working with WHO, what advice do you have in terms of adjustments and precautions, especially for women, for children, as well, especially because they're not going to school? What advice do you have for us in terms of adjustment as we forge forward, you know, so still in this situation of the pandemic?
No, thank you for your question. And you know, some of the things that have been preached now are things that we should have been doing anyway. You know, COVID has had ravaging effects, but I must say that from time to time we have influenza, and it just has as bad outcomes as we have. It's just that, you know, people end up with pneumonia, some recover, some don't. But what I would leave as a message is that whether we have a vaccine or not, we should continue to practice what I call good hygiene practices. And these good hygiene practices start at home, because we must always wash our hands. So that's the first W. I'll talk about these 3 W's that we must never leave, and we should have held to in any event. Always wash our hands. We use the bathroom, we teach children, wash your hands. We touch our nose, we go outside, do the garden, wash our hands. So I'm just saying, washing of hands has just been associated with COVID, but is what we should have been doing anyway. So washing hands is the first W. Okay? The one about wearing masks, I must say that we should recognize that in Asia, most countries were exposed to SARS, were exposed to a number of outbreaks. And we actually learned from their experiences that when you have these outbreaks where you have droplets in the air or aerosols, that can be the means of transmission of a particular disease. Wearing a mask is mainly to protect others from infection. So it should just be by way of habit and that you wear a mask so that you don't pass on your, your droplets to others. I would even say that if this has been our practice, even for tuberculosis, maybe our infection rates, because anything that gets suspended in air or that is contracted from the surfaces and so on, would require that we use the second W of wearing a mask, of washing our hands. Those that are on surfaces means we wash our hands, we clean the surfaces. Okay? The third W is that of waiting away, and you can actually wait a few distances away, and so that you don't pass on infections. Now, if that becomes a practice, and I've been saying to people, it's just unfortunate that we use the word social distance. It should have been physical distance, because it's just a physical distance. But we can't be socially distant as human beings. We are socially connected, and that social connectedness is extremely important, because we get to be a system of support, a system of engagement, but also a way to commune and a way to interact as human beings. So the social part must continue. It's only the physical part. So if we wait a few distances away when we want to engage, we can then introduce the third W. So it means that with or without the vaccines, those good hygiene measures must continue. We've seen in those countries in Asia how they succeeded because they practice good hygiene measures. And I think the good hygiene practices are important just as a good primary health care and public health. So we can promote those and we can educate people about those. It doesn't involve a lot of money. It doesn't involve money at all, because we start at home. We start at home talking to our children, talking to our husbands, talking to our relatives, and the message spreads. With these digital tools, social media, we just reinforce the same messages, educating each other that way. If the vaccine comes, yes, by all means. It's just like with HIV and AIDS. We started with prevention measures. And our prevention measures were about ABC: abstain, be faithful, and condomize. So we had those messages. Even here, we've got these 3 W's, and again, it's prevention measures. I thank you.
Wow, wow, amazing.
Wow.
Thank you so much.
Thank you.
Thank you so much. The 3 W's are things to remember, the 3 W's. And actually, I totally agree with what you say, because here in Kenya, we had so many children getting sick. So hospitals were so full of children because they have, these influenzas and other diseases associated to hygiene. But right now it's being reported that they have reduced, because the message of sanitize, wash your hands, and wearing a mask and keeping the social distance has been there every day. And everyone is afraid of the virus. So they know there's no other option but to stay clean. So I think that's for sure. The solution, we already have it, and we had it before the virus. So that is really a kind reminder and very good. So thank you so much for that. And also, I would also want, I would be interested to know about something, because you did mention that health is a very important indicator when it comes to development. And so this, so especially for Africa, we have, and I'm asking this because you're also a pharmacist. What would you say about our herbal medicine, the herbal products that we have available locally? Because I've had some countries and communities using that, and they have claimed that it's curing the virus. What are your thoughts when it comes to embracing herbal medication and herbal ways of treating some of these diseases?
Well, I'm happy that you are raising that. You'll recall that in my input, I refer to research and development. What I did not disclose is that when I was in WHO as a director, I was the director of essential and traditional medicines. And when we look at traditional medicine, there are three things that I want you to, I want these to be your take-home messages. Is that when you look at, and you have herbal medicine and you have traditional. Different countries have their own practices of traditional medicine. If you go to India, they use Unaniti, Siddha, Ayurveda, and so on. If you go to other countries, they use homeopathic remedies. If you go, so these are what we describe as complementary medicines. If you come to Africa, we recognize that there are African traditional medicines, but these are crude plants. They have not been formulated into tablets, medicines, and so on. And we actually draw a very, we draw a line on the sand in that those medicines, immediately you go into a big plant and you start manufacturing, then you must be subjected to good manufacturing practices because you are going to combine those extracts from plants with chemicals. And we need to understand whether there's contamination. We need to understand whether they are pure. But we also need to understand when you went to collect the plants, did you do it in accordance with good agricultural practices? Were they subjected to a lot of pesticides and insecticides? Because you don't want to expose people to that. So you have to show us in the tests in the laboratories that there are limits with regard to those chemicals that are likely to cause harm to people. So, but we do recognize that people plant, in their garden, herbs, and those herbs they use personally. So there are monographs that have been developed, and those monographs outline what each plant is used for. The difference is when you start taking the plants and you start producing and putting them in bottles for commercial purposes, then you must be subjected to regulatory control and regulatory, you need to comply with the regulatory requirements. So there are three regulatory issues that I think we need to resolve, especially in the African continent. And this has 3 Ps. I'm sorry, I'll always make it simpler for you. The 3 Ps start with the people who practice the traditional medicine. It's always good if we know what they're practicing so that they can be subjected to certain standards and codes. There must be a practice code so that they don't do certain things that are harmful and so on. But so that practice code must be agreed upon with those who practice. The second is about the actual product that they use, okay? So if they use a product and it's just a plant and it's compounded for personal use, it's not the same as if a product is manufactured at large scale. So we have to subject that product to certain regulatory requirements, and those who want to sell must meet the requirements. And the third P is about the actual profession. So it's the product, is the person who practice, but it's actually the practice itself, the professional practice. So if you see this as a practice, you need to say this type of professional, this is how they must practice and this is how they must behave. So you come up with what we call good professional practice standards, meaning it's the practice of the profession, is the professional, the person who practice, the person himself, and also the product. So you must come up with that kind of framework. Then it helps, even when you educate the public, they can ask the relevant questions and they can ask, what is your practice? And what kind of professional are you? And what products are you using? So it becomes that comprehensive, but it's easy to understand for an ordinary person. I thank you.
Thank
Well,
you so
thank
much. Thank you, Precious. Yeah, I think because of time,
Yes.
and on the 9th of August, Precious Matsuso, Director General, I'm sorry that I'm not the one who have disclosed. She have disclosed herself that she's the co-chair of Digital Health, World Health Organization. Really, thank you so much for sharing your expertise, your knowledge, you know, and even your experience. And as I said, I've learned systems from Precious Malibona Matsoso, very organized, very strategic. She says that I'm a praise singer. As a Christian herself and also myself, you know the Philippians 4:8. I believe in this Philippians 4:8. It says, brethren, whatever things are true, whatever things are honest, whatever things are just, whatever things are pure, whatever things are lovely, whatever things are of good report, if there any virtue and there be any praise, think on these things. Amen. And
Amen.
in our midst, we are also having Mankole Masisi Takisi from Lesotho, the president of Lesotho. Can you say something, just to say something to this precious woman, Precious Matsoso, Director General Jigelela? I thank you. Mankole? Mankole? Did you grew up in Lesotho? I think it's also your motherland.
My father, not me.
Yeah.
My father was born in Lesotho.
So there is a problem there. Mankole Masisi Takisi, she is also the president of World Women Leading Change in Lesotho. And you spoke about digital health. And I think also she is also working in one of the university they called Botu University. We want to link her with you. And we've got also in Namibia, we've got a young lady, very dynamite, Chas Mahuluma. She is on technology. We want to link her with you. We've got also Ameline from Burundi. She is also the president of Burundi, of World Women Leading Change. But without wasting time, the 9th of August, we'll be having Precious Malibona Matsoso. She even spoke about, if ever you think of development, you must look at the vulnerable people. We must look at the young people. And that is the mission of the World Women Leading Change, whose founder is Professor Ayla Alfuri from Indonesia. And also in our midst, we are also having the president of infrastructure in Africa, President Rebecca Murudi, and even the president of World Women Leading Change on youth sector, And Jolly Joy, the one who is there, who keeps on interviewing you, she's the president of Kenya, World Women Leading Change, also the Wellness Center. She is the one who is doing this session every Friday. So on bilateral or on tripartite meeting or fourth, I don't know what is another one, quadripartite meeting, you can advise us. We need your expertise on how we can be able to take the World Women Leading Change, especially on the Wellness Center. I thank you. Because of time, President Chase or Makole, are you in the university? Can you say thank you to us?
Yes, President Debbie, I'm here. I'm in and out of other meetings, but I am listening in, and it's refreshing, an inspiration. It's humbling. I just want to congratulate WWLC to be able to put together such experience, honorable speakers, international speakers, and at a time like this when women are actually pioneering and we're remembering our grandmothers who took us to this day. This is very special to us in the Sub-Sahara because we know what our mothers did in South Africa to liberate the region. We are so humbled. We are honored, and the information, the guidance, and above all, the African grace and humility. This is what touches me. You know, I am looking at Mama Matsoso and I'm like, you know what? I'm going to be like that. Thank you so much for the guidance. Thank you so much for the inspiration, and the information is so building and so humbling and gives us hope, especially when we have young women like Bochaz, young women like Boleseho around, who we know that we are creating a solid foundation for Jolly Joy. We have hope for our children and our grandchildren. Thank you.
Thank you to all of you. Thank you for inviting me.
Very much. Thank you very much, Professor Precious.
Thank you.
I'm just marveled. I'm just amazed by just your portfolio and everything you've spoken about. And knowing that you started this when you were 16 years old. And imagine those days, it was not only apartheid that you were fighting against, but also women discrimination. We know our African culture, how it is discriminating, and actually the world as well, how they discriminate women, and the levels that you've just surpassed. Mama Debbie, I cannot thank you enough for bringing her here. I really appreciate it. And definitely we are going to connect with her on the digital platform, on the health digital platform and everything, and just draw the knowledge from her. We thank you very much for you availing yourself for this platform. We know you are a busy woman. Thank you. That's all I can say.
Thank you so much.
In 9 August, 11 a.m., dress code is black, and the Mama Precious Matsoso, she's wearing the red duke or whatever, but we shall be wearing purple. Those are the colors of World Women Leading Change. At 11 a.m., please, we are saying join us, and thank you very much for accepting our invitation. Thank you so much. Thank you to you, Jolly Joy. Love and light. Where is President Ayla?
Thank you.
Yes, grateful. Thank you so much, and we totally appreciate you for joining us today and for sharing your wisdom with us. I wish we had much time, but we'll be reaching out to you a lot of times. Thank you so much. May the Lord bless you, and may the Lord keep you. Until we meet again on Sunday, remember it's 11 a.m. Southern African time, but for us in East Africa, it's 12 noon. So until then, and stay safe. Remember the 3 W's Mama has told us. Let's wash our hands.
It's 3 W's. You've got 3 W's. You've got 3 P's, and you've got
P's.
Competence, care, and compassion.
Yes, 3 W's, 3 P's, and 3 C's. Thank you
Yes.
so much.
Welcome. Bye.
All right.
Where is
Okay,
President
bye.
Ayla? President Ayla? President Ayla? I see also Jalstina. President Lesego, thank you so much. Thank you. Love
Yes,
and
thank
light.
you.
Bye-bye.
Christina. Thank you, everyone. All right, bye for now.
Thank you,
Bye.
everyone. Love and light from Bogor. Thank you, President Debbie. Love you all. Love you, my president. You are leading the changes.
Bye.
Love you so much, Dr. Ayla. Thank you.
Bye-bye.
Bye.